What actually causes varicose veins and spider veins? How dangerous is this for my health? Is it possible to treat varicose veins without surgery? Watch this video until the end, and you'll find out which treatment methods are currently considered the best. I'm Dr. Vasyl Chaika, and I'm here with you. Let's get started. According to statistics, varicose veins affect 25% of the world's population. It's important to clearly distinguish between varicose veins and the expanded vascular network, which is often mistaken for varicose veins. Because varicose veins are the dilation of veins that have valves, while the expansion of this vascular network involves very small veins, only about 3 millimeters in diameter at most, so there is essentially no valve apparatus there. What else is very important? With varicose veins, the function of the valve is disrupted, swelling of the vessel wall occurs, pain develops, the blood thickens, and blood stagnates in the leg. Interestingly, only about 1.5% of people with varicose veins experience problems that truly threaten their lives, such as thrombosis or thrombophlebitis. The rest only experience physical discomfort and aesthetic issues. Now, let's move on to the reasons why varicose veins occur. So there are mythical causes that have nothing to do with varicose veins, but they can sometimes be present in people with varicose veins. So, first, heredity. My grandmother had it, my mother had it, so I will have it too. We will discuss later why this is a myth. Next, this is excess weight. Then, this includes pregnancy, lack of estrogen, wearing uncomfortable shoes, and for women, wearing high heels. Your gender, your age, all of these are mythical causes. So what are the real physical causes? You need to understand the following. Veins have one particular feature that distinguishes them from arteries. Arteries have a thick muscular wall, and it is this muscular wall that ensures the propulsion of blood moving through the arteries. But veins do not have this mechanism. They have a different mechanism. That mechanism is valves. And the function of compression, or the muscular wall, is performed by the muscles through which the veins pass, for example, in the lower limbs. That is why, for example, when the muscles are weak, blood can pool in the lower limbs and venous congestion can occur. So what is most often the cause? First, it's some kind of disturbance in blood flow that arises. What could that be? If we have a main vein through which blood flows to the heart, called the inferior vena cava, then the primary main cause is a spasm of the diaphragm. The diaphragm is a respiratory muscle that can partially compress the inferior vena cava and lead to blood pooling in the pelvic organs. Another cause is problems with the liver. This vein passes through the liver, so in cases of fatty hepatosis, for example, with liver congestion, liver swelling, as well as with cirrhosis or other fibrotic changes, there will also be compression of the vein and congestion. A bloated abdomen, which occurs when there is improper nutrition or an imbalance in the combination of proteins, fats, and carbohydrates, also leads to compression. What else can we include here? These also include adhesions that form in the pelvic organs, for example, very often after surgical interventions, or for instance, other causes of inflammation in the intestines can also lead to adhesive disease. This will mechanically compress the vein. What else can cause this? This includes swelling and inflammation directly of the vein wall itself in various diseases. These are the physical level causes of what is called varicose veins. The flow of blood through the veins becomes obstructed. As a result, it accumulates in the distal parts. Directly in the legs, the vein can become distended, and this causes both physical and visual discomfort. Well, besides the physical components, there are also emotional ones. Remember, we talked about how muscle tissue, as well as tendon tissue, the walls of veins and arteries and bones are all involved. They are controlled by the brain's matter. And so, if certain situations arise that a person perceives as this weight tied to their leg, they have to drag this burden along. I can't get rid of it. For example, when a woman becomes pregnant and she can no longer live the life she wanted before. Or for example, a woman needs to take care of her mother who has become ill. Or for instance, a child wants to leave the parental nest, but until they finish school, they can't do it, and they perceive this as a burden. This is what will lead to changes in the walls of the veins. They will become thinner, and as soon as the situation ends, for example, the child is born, everything with the mother gets better, she recovers, or the child goes off to study, then varicose veins appear. And what else confirms this approach? It's something you can determine for yourself. For example, if you are right-handed, how do you determine whether you are right-handed or left-handed? You pick up a child in your arms. If we pretend this is a child and you hold the child like this, with the head resting on your left arm, then you are right-handed. If you hold the child like this, then you are left-handed. Therefore, when you develop varicose veins in your right leg, it is related to the fact that the weight, this is interpreted as a partner, friend, colleague, acquaintance, father, brother, or sister. And if it's on the left and the person is right-handed, it doesn't matter whether it's a man or a woman, then the weight is either the children or the mother. So now, do you understand why varicose veins occur more often in women than in men? Because children and the mother are a burden that a woman cannot leave behind. As soon as the situation ends, what is called varicose veins appears. Another emotional component is that the woman or man constantly lowers their self-esteem in this area. They say, oh, now my leg isn't as beautiful. Oh, I'm so bad. And the reflex repeats itself. Now let's figure out how we should work, what we need to do correctly, and whether we can avoid surgery. Understanding the causes, let's now move on to what can be done. Is surgery necessary? Surgical intervention is only needed when there are complications, and that's just 1.5% of cases, when there is thrombosis, acute vein thrombosis. In that case, surgery is necessary. In other cases, it is not needed. We have time, and we can calmly handle this. After all, remember that the main reason is not that something bad has happened to the veins, but rather the physical and aesthetic discomfort that a person experiences. So, what do we need to do? On a physical level, we need to create conditions that help the vein contract better. What helps with this? So first, there is compression wear, which you can put on your legs, and it will essentially create an additional, almost muscular wall. Another option for compression is measured physical activity. This could be walking at a comfortable pace for you for about an hour, or doing squats as long as they feel comfortable for you. Another method is taping, which can also be used. These are special, sticky, elastic band-like tapes that can be used on the legs. What else can we add? We can add various exercises, yes. For example, the same cockroach exercise, which is used for lymphatic drainage when we lift our arms and legs up and perform it. These are the physical aspects. What else needs to be done? This involves working with the diaphragm. That is, you need to learn to breathe with your belly. We work with the liver. How? We normalize liver function, perform visceral therapy, reduce swelling of the liver, and take choleretic agents. We also eliminate bloating. This means properly adjusting proteins, fats, and carbohydrates, and avoiding foods that cause us to bloat. Additionally, on a physical level, we can use contrast showers. So, why do we need this? That is, the temperature difference will actually make our muscles contract, further enhancing this pumping function. How do you take a contrast shower? It's best to do it in the morning and in the evening. The duration is 15 minutes. For 1 minute, we pour warm water over our legs, then for 1 minute, cold water. What's important? We do it not from top to bottom, but from bottom to top, that is, from the heels up to the waist. Another additional method is hirudotherapy. But here, people make a lot of mistakes. They place leeches directly on the veins. This is incorrect. You shouldn't place them on the veins. You need to normalize the outflow higher up. So in fact, the first placement of leeches should be in the navel area, then in the liver area, normalize the outflow in the pelvic organs, and only after that, work directly with the veins. That's it. On the physical level, this is basically enough. What else can be done additionally? Additionally, we can use certain remedies that allow us to reduce swelling and directly relieve pain in the vein. And then our well-being will improve. There is a huge variety of different creams and ointments. They simply relieve swelling. I would like to suggest a recipe to you now, which in my opinion is very, very effective. So I will read it to you now. We need to take 20 grams of yellow sweet clover, 30 grams of hazel leaves, 15 grams of raspberry leaves, 10 grams of dandelion root, and 40 grams of red grape leaves. All of this should be in dried form. You take this mixture and mix it together. Next, take 1 tablespoon of this mixture, pour 700 milliliters of water over it, let it steep for 1 hour, and then consume these 700 milliliters throughout the day. The water temperature should be 60 to 65 degrees Celsius. How long should you take it? This is for 2 to 3 months. What does this herbal blend do? It relieves inflammation, reduces swelling, and normalizes the rheological properties of the blood. After the physical component, let's now move on to working with the emotional component. What needs to be done here? What should we influence here? So we know that the cause of the emotional component is our perception of certain events in our lives that we experience as a burden. It could be the children, it could be the mother, it could be the husband, and so on. So what should we do here? Yes, you can divorce your husband. You can move away from your mother. But what should you do about the children? Change your attitude. That's the most important thing. And here, the best thing is that you need to think biologically. What does it mean to think biologically? And that means that children are the continuation of your lineage. Your children are the way they are. They can't be different. They can't be like the neighbor's children. These are your children. They are your copy. That's why we accept our children as they are, because they are ours. My mother is the way she is, because she is mine. And when I need to take care of her, it's not because I have to, but because I enjoy it. And if I don't enjoy it, then you hire someone to take care of her. If your husband is a burden that you are dragging along and he drinks, then leave this man. So remember, emotional issues need to be resolved biologically, not just endured socially while you keep living on. Because the longer you endure it, the more changes will occur. What else is very important? It's that when veins appear on your legs, along with pain and discomfort, this aesthetic devaluation of yourself arises as if now you have become unattractive. What needs to be done here? First, once again, think biologically. If you are experiencing certain changes, does that mean you are dying from it? Ask yourself one simple question. Are you dying from this? No. If you really aren't dying, don't pay attention to it. Yes, these changes will happen. This is simply your feature. This means that you have passed this stage, you have survived this shock, and you have come out of it the right way. Use these recommendations and stay healthy.